Hello student, this question is from Fundamental of Nursing. Huge one. Infected bandage discard in which bag? Yellow.
Correct answer. Yellow bag. All dressings, bandages and cotton swabs with body fluids, blood bags, human anatomical waste, body parts are to be discarded in yellow bags. Triage means A. Large, B. Emergency, C. Sort. Correct answer. Triage is a process of sorting patients based on their need for emergency treatment. It is used when there are more patients than available resources, and it helps to ensure that the most urgent cases are treated first. Which position given to patient in sigmoidoscopy? A. Prone, B. Supine, C. Lithotomy, D. Knee chest. Correct answer. Sigmoidoscopy is the minimally invasive medical examination of the large intestine from the rectum through the nearest part of the colon, the sigmoid colon. There are two types of sigmoidoscopy: flexible sigmoidoscopy, which uses a flexible endoscope, and rigid sigmoidoscopy, which uses a rigid device. The choice of TURP transurethral resection solution for irrigation time. A. Normal saline. B. Plain water. C. Glycerol. Correct answer. Transurethral resection of the prostate TURP typically utilizes large volumes of irrigation fluids for distension and irrigation during the procedure. Historically, these fluids were slightly hyposomolar solutions of glycine, sorbitol, or glucose. When cleaning the eyelids, the nurse should clean from the A. Inner canthus to outer canthus. B. Outer. Correct answer. When cleaning the eyelids, the nurse should clean from the inner canthus toward the outer canthus so as not to introduce debris or dirt into the lacrimal ducts that could cause an infection. Decannulization means A. IV cannula. Correct answer. Tracheostomy decannulation is the process of removing your child's tracheostomy tube. A head injury patient. Which alarming event soft surface show ill patients? A. Correct answer. Ear bleeding is a sign of a basilar skull fracture, which is a serious type of head injury. Basilar skull fractures occur when the bone at the base of the skull is fractured. This can happen as a result of a fall, a car accident, or other type of head trauma. A nurse would assess that a patient is experiencing Chine-Stokes respiration when he has. Correct answer. A nurse would assess that a patient is experiencing Chine-Stokes respiration when he has. Objective data collection method accept. A. Correct answer. Objective data collection methods are focused on gathering factual information that is observable, measurable, and independent of the individual's interpretation. Interviews, on the other hand, are a subjective data collection method that involves direct interaction and conversation between the interviewer and interviewee. Ringer and Hash 039 S lactate intravenous infusion solution does not contain which of the following? A. Correct answer. Ringer's lactate solution is a type of isotonic crystalloid fluid. It is used to replace fluids and electrolytes in those who have low blood volume or low blood pressure. It may also be used to treat metabolic acidosis and to wash the eye following a chemical burn. It is given by intravenous infusion or applied to the affected area. The first step of planning process is A. Correct answer. The first step of the planning process is formation of objectives. Objectives are the specific and measurable outcomes that an organization aims to achieve within a given time frame. These objectives provide direction and purpose for the planning process, as well as a basis for evaluating the success of the plan. Once objectives have been established, the planning process can proceed with other steps such as forecasting, deciding the plan of action, and time scheduling. Records and reports are maintained as A. Assess the treatment needs. B. Improve patient care. Correct answer. What should be the temperature of water used for tepid sponge? A. Correct answer. Tepid sponge is a process of sponging with tepid water to reduce body temperature by evaporation. The temperature of water used for tepid sponge is 80–90 degrees Fahrenheit. The normal blood pressure of an adult is. Correct answer. Angiography is X-ray visualization of A. Lungs. Correct answer. Angiography is X-ray visualization of blood vessels. It is a medical imaging technique used to visualize the inside of blood vessels and organs of the body, such as arteries, veins, and the heart chambers, using a contrast agent and X-rays. Who is known as the Lady with the Lamp? Correct answer. Florence Nightingale 1820–1910 was a British nurse, social reformer, and statistician. She was the founder of modern nursing. Which of the following is not found in urine? A. Only glucose. B. Only protein. C. Only red blood cells. D. All of the above. Correct answer. Normal urine does not contain glucose, protein, or red blood cells. Glucose is a type of sugar that is found in the blood. Protein is a nutrient that is found in the blood and in the body's tissues. Red blood cells are cells that carry oxygen throughout the body. The full form of AMBU badge is A. Airway mouth breathe. Correct answer. The full form of AMBU is Artificial Manual Breathing Unit. The heartbeat rate of newborn babies is generally A. 90 beats per minute. B. 80 beats per minute. C. 72 beats per minute. D. 120 to 140 beats per minute. Correct answer. A client in #039's condition following cardiac catheterization is evaluated by palpating the pulse. A. Distal to the catheter insertion. Correct answer. The pulse is palpated distal to the catheter insertion site to assess for adequate blood flow to the extremity. If the pulse is weak or absent, it may indicate that the catheter has blocked the artery, which can lead to serious complications such as tissue death.